you please introduce yourself?
Good afternoon. My name is Rebecca Garcia, and I'm a registered nurse at Starr County Memorial Hospital, and I work at the Labor and Delivery Unit.
Here are a list of questions that I'm going to be asking if you'd like to review them.
Okay.
Can you please tell me how you go about establishing relationships with your patients?
Okay, well, basically, I believe that in order to establish a relationship with your patient, it all comes down to trust. If your patient doesn't trust you, there's no way you can have a relationship with them. And the way I establish my relationships with the patient is I simply go into their room, introduce myself, give them a handshake, not only to my patient, but to the family as well. You ask them, is there anything you need? Are you comfortable? Are you in pain? I feel that those are the main questions that you need to ask your patient at the beginning. Also, I feel you should always provide privacy when you're going to give any type of care, because the patient deserves to have any type of privacy, whether they are a conscious patient or an unconscious patient. Also, I believe you should also listen to their concerns. If they have any type of concern, you should always take it seriously. If they have any type of question, you answer their questions. Don't leave them doubting. Especially in my job, I work in labor and delivery. I feel that it is very important to answer the mother's questions. They want to know, is their baby okay? Is everything fine? Are they doing okay? So I feel as long as you're honest with them, you develop the trust, you develop a good relationship, everything should be good after that.
So you're always open-minded with your patients, that's like key.
You should always be open-minded with your patients, yes.
That's great. Okay, I'm gonna ask you now, what are some of the barriers you face in establishing relationships with your patients?
Well, in my job, we work very close to the border. Our hospital is very close to the border, so many of our patients are illegal immigrants.
Yeah.
And it's sad that most of them come in and they feel they can't tell you the truth. You ask them questions, have you been seeing a doctor in Mexico? And they think they have to say no, because then you won't care for them if they have. You ask them, is everything okay with your baby so far? And they tell you, yes, everything is fine, everything is perfect. Then upon delivery, you find out the baby is not okay. For instance, I had this case, we had a patient, she came in through the emergency room, she was dilated to complete, but baby was coming breech, which means she can't deliver vaginally. So we had to take her into an emergency C-section. Then upon delivery, her baby takes one breath and codes on us, which means the baby basically dies. So we start coding the patient, but the patient is conscious in all of this. And then she says, the doctor asked her, did you know that your baby, anything was wrong with your baby? And she said, she starts crying and she tells us, yes, I knew that my baby wouldn't survive as soon as I would deliver. Her baby was born with Potter syndrome. But she felt that if she would tell us the truth, then we wouldn't take care of her.
What exactly is Potter syndrome?
Potter syndrome means the baby doesn't develop his kidneys. There's several defects with the baby, as far as, their brain, their eyes, stuff like that.
Okay.
So basically there was no way the baby would live. And we tried, but, and she knew all along. So I feel that's one of the biggest barriers that we have, that they feel they can't tell us the truth.
They can't be honest.
They can't be honest with us because
they're not going to receive
the care that they need.
Okay.
But it's not like that. But they don't understand that.
Wow.
Mhm.
That is a huge barrier to deal with.
It is. And it's hard sometimes. It's hard to make them understand that they can be totally true to it. They can be honest and we'll give them the care. But sometimes it is hard. And I feel that's one of the biggest barriers that we have at our hospital.
Wow. What do you find to be the hardest part of your job when having to handle patient concerns?
Well, as I said earlier, I am a labor and delivery nurse. So to me, my hardest part to deal with my patient is when I have, let's say the patient comes in for a scheduled C-section, and upon arrival, there's no fetal heart tone. As a nurse, I cannot let the patient know.
The patient as in the mother?
As in the mother. I cannot let the mother know that her baby doesn't have a heartbeat. That's the physician's job. As a nurse, you can only do so many things. So that's the part that I feel is the hardest. The patient is asking you, is everything okay? Or if we have a laboring patient and we start having her baby decel, which means her baby's heart rate starts going down. And, nurses start to panic. Honestly, nurses are running in and out of the room. You're repositioning your patient, putting oxygen on them, and they want to know what's going on, and you can only tell them so much. until, of course, the doctor gets there. So for me, I feel like that's my hardest part dealing when it comes to those type of concerns, of course, because that's my job, in labor and delivery. It's hard, that you can't be honest to the patient as far as to tell them, like, if they don't have a fetal heart tone, and tell them, what, your baby is no longer living inside you. You have to wait basically until the physician comes in and tells them.
And you have to put on the straight face.
And you have to put on a straight face, act like everything is fine. And to me, I feel that's the hardest part of my job when it comes to those type of concerns, when it comes to having sick babies, that they want an update on how their baby is doing after the delivery. Baby is really sick, but that's the physician's part of the job.
And you can't say anything.
Just tell them, we're trying our best. We're trying our best. But one thing that I've learned is that you never promise a patient, in this case the mother, you never promise them that their baby is going to be okay. You never promise. And you learn on the job that you can never make those type of promises, because sometimes you can't keep the promise.
Wow.
Yes.
Okay. How do you go about advocating for your patients? And you can speak about advocating for your patient as in the mother, and advocating for the patient with the baby.
As far as advocating for the baby, I feel that sometimes you get a baby and upon delivery they're fine, they're completely fine. Then later on, an hour and 2 hours after the delivery, you find that the baby's having trouble breathing. You try to feed the baby and the baby turns blue, baby stops breathing. I feel as far as advocating, that's our part where we call the doctor and tell the doctor, hey, you know what, doc, something's wrong with this baby, you need to come over here, take a look at the baby. Of course, initially the doctor will probably tell you, you know what, let's try these interventions. You follow your nursing interventions, you follow the doctor's interventions, but you see the baby's not getting better. So as a patient advocate, you call the doctor and you tell the doctor, you know what, doc, I need you here now. And I feel that's the biggest part of advocating, especially in the nursery, when it comes to the babies. Always being on top of the babies, always speaking up for the babies. When a baby is basically not doing well. As far as mothers, I feel that the biggest part of advocating for the mothers is when they're in so much pain and the doctor hasn't ordered an epidural or the doctor hasn't ordered anything for pain. I feel the biggest part of advocating for them is calling the doctor and saying, you know what, this patient needs something for pain. And the patient is so grateful to you when you do give them something for pain and their pain is finally relieved. They think you're the best person in the world because you finally helped them. Their pain has calmed down, they're doing better. And then also I feel that whenever you do have a situation going on as I said earlier, when the baby starts descending, baby's heart rate starts dropping before delivery, while the patient is in labor, I feel being a patient advocate is very important at that point, because you follow your nursing interventions, like I said, and once you see it's not working, you need to call the doctor. You know what, sir, you need to be here now. Or, you know what, ma'am, you need to be here now. It doesn't look good. And, basically telling the doctor, you need to get here now because this patient needs help. So I feel that's the biggest part that's the advocating that I do as far as that goes for my patient.
For both your patients, as in the mother and the baby.
Mm-hmm.
Okay. How do you share the decision-making process with other health professionals, such as your coworkers? It could be the nurses you work with, the physicians, or the CNAs.
As far as the decision-making process, I say we take it in steps, basically. We sit as nurses, we speak amongst ourselves, we try to decide what's best for our patient.
Do y'all have weekly meetings?
We do. We have weekly meetings. I mean, if we do have patients, we have daily meetings every morning. You meet with the night shift, you sit and we talk about the patient. It's basically you get report from your night shift nurse and she gives you a report on your patient, what's going on. She tells you if there's any problems. If there is problems, that's when what I do is I include the rest of the nurses on my unit. I sit down and I tell them, hey, you know what, we have this going on. What do you all think I should do? We sit, we speak amongst ourselves, and if we feel like this is out of our league, basically, we'll call the doctor.
Okay.
We'll call the doctor, and even at that, sometimes it's not only about the doctor, sometimes we need to call respiratory. Maybe our patient isn't breathing correctly, or if I'm working in the nursery, and like I said earlier, we have a baby that isn't breathing correctly, we'll call respiratory to come in, evaluate the baby. call x-ray, maybe something's going on in the chest, have a chest x-ray done, so it's about collaborating with everybody, as far as respiratory, x-ray, the physicians, and the other nurses on our unit as well.
Okay, so it's not just the nurses and physicians.
No.
It's a whole team.
It's a whole team basically to care for your patients, and even at that, you also have lab. Maybe the baby's glucose is dropped. Maybe the baby has an infection. It's integrated. Yes. Every patient basically. When it comes to one patient, you call everybody on the team.
Depending what they need.
Depending what they need and what the problem is basically.
Okay. Wow. Okay, that's great to know. How do you collaborate, communicate, and integrate care as a team to ensure that care is continuous and reliable?
Well, it's just like I just said, if you do have a problem, the way you collaborate. You collaborate with the other teams, with respiratory, with lab, with x-ray. And I feel like in order for the patient to have good, reliable care, everybody needs to be aware. Okay. It's like if we have a laboring mother and we feel like, okay, this patient has been in labor for a long time, there might be problems with this baby upon birth. Once the mother goes to complete and is about to deliver, we will call everybody. Can we have respiratory here? Can we have x-ray here? Can we have lab here? They're all waiting outside the delivery room. And as soon as the baby is born, if we say, hey, you know what, we need you here, they're on standby. They're right there. They come in, they work on the baby, they stabilize the baby, and that's it. They walk out, Then afterwards, hey, you know what, thank you so much for being there for me, for helping us out, As far as it's the same way as when respiratory is having a patient, they can have a patient going in for a simple halter placement. It's a patient going in to get their heart monitored.
Okay.
And let's say their patient codes on them all of a sudden, they're having a heart attack and they just collapse. They call a code and, there go the nurses, the x-ray, the lab, they all go to help respiratory out also with their own patient. So I feel like as far as collaborating, integrating, that's the way we do it. We work as a team at our hospital, and I feel that because we're such a small hospital, it's so much easier to work as a team.
And working as a team, things always get done a lot smoother.
Yes, because everybody knows everybody. Everybody already knows the way you work.
Okay.
I've been there for a year already, but everybody knows what I'm good at, what I can do. So I feel that that's why our hospital is so close and so united, because everybody knows everybody.
Okay, and you all work together to care for
for our patient, and that's why we have good, reliable care at our hospital.
Okay, that's great.
Mm-hmm.
How do you work through your coworkers' individual beliefs and values?
Well, I feel that that's kind of a touchy subject, but I feel we should always have an open mind and respect everybody's beliefs. I feel if they're out of line, they're not respecting the patient because the patient may have different beliefs, I feel like I should tell them, hey, you know what, let's settle down and respect her beliefs and her values. Everybody is different, and I just feel that the best way for me to deal with it as far as with my coworkers is to keep an open mind and to respect them.
That everybody has different beliefs.
Exactly, and everybody has different beliefs, everybody has different values, and that's fine. That's fine, and that's life basically. Everybody believes differently, and as long as you respect them and you have an open mind, I feel everything is fine. Everything can be fine, and you can work good, with each other.
Okay. How do you work through your patient's How do you work through your coworkers' individuals' beliefs and values?
Well, as I said, it's the same thing. Coworkers and
Patients.
And the patients. It all comes down to the same thing. You have to keep an open mind with them, and sometimes you can have coworkers so stubborn as well as you have some patients that are so stubborn also, and all you need to do is just take a step back, just stay open-minded and respect them, and yes, they ask you for your advice, and sometimes you feel like, maybe I shouldn't give my input because they're so set in their ways. But I just feel as long as you have an open mind, as working with coworkers and working with patients, you'll be fine as long as you keep that open mind and you stay positive, and just respect them and their own beliefs.
Basically the same for both your patients and your coworkers. You just keep it the same way.
Keep an open mind and just stay positive. And, sometimes you're out of line, like I said, but I mean, at the end of the day, in my job, I mean, it's their baby. If they don't want to breastfeed, how can I impose on them and tell them, you know what, you need to breastfeed? No. I can recommend it. Hey, you know what? I believe that breastfeeding is the best for your baby, but at the end of the day, if they don't want to breastfeed, you know what? That's fine. You know, it's your baby
That's
at the
a
end of the
perfect
day.
example.
Mm-hmm.
It's a great example of it. What are some techniques that you use to help you better understand your patient's needs?
Basically, when it comes to, I feel like that comes down to your patient care. You know, you need to sit and listen to your patient. If the patient is telling you, you know, I have a lot of pain to my back area, you know, stuff like that. A lot of nurses don't take that seriously,
Okay.
and they think you're having a baby, you know, that's why you're in pain. Not all the time does it have to be perceived that way, you know. Sometimes baby can be in a bad position, that's why the patient is having so much pain. And I feel that in order to care for the patient and deal with their needs, you have to listen to them and listen to their concerns, their needs. And if they're telling you, you know, they're firm on saying, you know, I have really bad pain, and you've taken care of their pain, they have an epidural, yet they still have pain. I feel like you need to take a step back and think, you know, why is it that they still have pain even though they have an epidural? Maybe they put the epidural in wrong. You know, and like I said, you know, maybe the baby is positioned wrong, you know, and that's when you need to take the patient's word for it and trust what your patient is saying and call your doctor, you know, and most of the time the patient is correct. Something is wrong.
Something is wrong.
Mm-hmm.
What about the babies? I know it's so hard to you can't communicate with the baby. They can't speak to you to tell you what's wrong. How do you go about that with the patient?
It's basically cues, you know, cues that the baby gives you. If you have a baby that's crying and crying and crying, if it's a high-pitched cry, usually the baby is in pain. Baby is in some type of pain. Maybe they had trauma upon delivery and their head hurts, you know, but it's studies have shown that if a vacuum is used upon delivery, a baby can have a headache for 3 weeks.
Oh, wow.
You know, so that's what, and if the baby, let's say the baby, if that did happen in that case, baby was delivered and a vacuum was used, you have this baby crying and crying and crying. Maybe they don't have their little beanie on, their little hat. Put on their little hat, it compresses their head, and that can relieve the pain. You know, because as far as pain medication, you don't give a baby pain medication, not newborn, you know. Maybe sometimes they just want to be held. You know, they've been in their mother's womb for 9 months and all of a sudden, you know, there's bright lights, it's noisy, it's beeping, you have IV machines beeping everywhere. They're getting poked at basically, you know, getting their vaccines, getting injections, getting blood drawn. Sometimes with the babies, you need to be more careful, and I feel like you need to be on top of them, at least for the first 3 to 4 hours of life. You know, that's the most critical. Yeah, especially even the first hour of life, you know, that's why they always recommend, you know, the skin to skin bonding with the mothers, of course, you know, because that helps the baby adjust to the environment, because they're shocked when they're delivered, you know, like they're out in the world basically, you know, and it's a big shock to them. But as far as the babies, it's a lot of cues that they give you, you know, because of course they can't tell you like, this hurts me, or I'm hungry, or, you know, they basically, you go on their cues, you know, if they're breathing too fast, if their heart rate is too fast, that can always indicate infection, you know, it can indicate something is going on with their lungs, with their hearts. So basically you need to just be on top of the babies. That's what it comes down to. Mm-hmm.
Okay, that's great. Well, I appreciate you taking the time to do this interview with me. I have learned a lot a lot of information that I would have never even thought of when it comes to labor and delivery. So I appreciate your time. This concludes our interview.
And I'd just like to thank you for giving me the opportunity for interviewing me, and I'm glad that you got to learn on this interview.
Thank you very much.
Thank you.